Hello everyone and welcome to the Biomedical Journal. Today we are going to talk about something that many people experience but might not always understand. Period blood and its different colors. The color of your period blood can reveal a lot about your health. So let's break down what each shade means. If your period blood is bright red, this usually means that the blood is fresh and flowing quickly from the uterus. This is typical during the early days of your period when the flow is heaviest. It's generally a sign of a healthy cycle. However, if you experience unusually heavy bleeding or prolonged bleeding, it might be worth checking with your doctor. As your period progresses, you may notice that your blood becomes darker, even brownish. This is because the blood has taken longer to exit your uterus, meaning it has oxidized. Brown or dark red blood is common at the beginning or end of your period and is usually nothing to worry about. However, if you notice brown spotting between periods, it could be a sign of old blood being expelled, which might be linked to hormonal imbalances or perimenopause. Pink period blood is often a result of your menstrual blood mixing with cervical fluid, which can dilute the color. This may occur at the beginning or end of your period. It can also be linked to low estrogen levels, which might be caused by extreme exercise, dieting or perimenopause. If you experience very light pink spotting regularly, it might be worth discussing with a healthcare provider. Orange period blood can appear when menstrual blood mixes with cervical mucus, creating a slightly different hue. However, if the orange blood is accompanied by an unusual smell or discomfort, it could be a sign of an infection, such as bacterial vaginosis or an STI. In such cases, it's best to consult a doctor. If you ever notice gray or off-white discharge mixed with your period blood, this could be a sign of a bacterial infection, such as bacterial vaginosis. It's important to seek medical attention if you experience this, especially if you have a strong odor, itching or discomfort. Black period blood might seem alarming, but in most cases it's just older blood that has taken a long time to leave your uterus. This can happen after your period ends or if your flow is very light. However, if it's accompanied by pain or a foul smell, it could indicate a blockage or infection, so be sure to get checked by a healthcare provider. It's common to see small blood clots during your period, especially on heavy flow days. These are just clumps of coagulated blood and tissue from the uterus. However, if you notice large clots, bigger than a quarter, frequently, it could be a sign of conditions like fibroids, endometriosis, or a bleeding disorder. If this happens often, consider talking to your doctor. While period blood can come in many different colors, most variations are normal and depend on factors like oxygen exposure, flow speed, and hormonal balance. However, if you notice unusual changes, such as foul-smelling blood, very heavy bleeding, prolonged periods, or grayish discharge, don't hesitate to seek medical advice. Understanding your body is an important part of self-care. If you found this video helpful, be sure to like, subscribe and share it with anyone who might need this information. Thank you so much. See you next time.